So in the Commonwealth of Massachusetts, all Medicaid plans cover acupuncture. It is different per plan. So like BMC HealthNet covers a multitude of visits. Not everybody takes them, their health plan, but they will cover unlimited visits. Mass Health covers 12 visits, then they'll cover an extra 8. So you get 20 per calendar year without needing to get intervention. And that's standard Mass Health, that's Mass Health ACO, that's any standard Mass Health plan. So it's 20 per year, but with something like long COVID, your provider can ask for more visits as necessary. And Commonwealth Care Alliance grants 36 treatments per year, which is another Medicaid plan, but that plan, you can also ask for more care if you need it. Not all commercial plans cover acupuncture in the Commonwealth, but most do. And some of the most commonly underwritten plans are Aetna. Aetna can do a bait and switch, so you have to be careful. Some plans only cover acupuncture for anesthesia for surgery, which is actually not in our scope of practice in the Commonwealth. But other Aetna plans do cover. Most Blue Cross Blue Shield plans in the Commonwealth cover 12 visits. Some cover 20. And federal Blue Cross Blue Shield has more flexibility. Cigna plans, some of them cover, some do not. Many acupuncturists are out of network with Cigna because of an organization they have chosen to oversee their administration that actually rewards acupuncturists for not giving patients the care they're entitled to under their plan, which to me personally feels like an ethical bait and switch. So I see Cigna patients out of network, as do many others. Harvard Pilgrim, typically their plans cover 12 to 20 visits per year. Tufts has public plans that cover and commercial plans that cover. And most United Healthcare plans, including Medicare Advantage plans. And so it's important to ask your provider if they take insurance. Next slide, please. Oh, and so, okay, so I wasn't sure if I wrote this. So Medicare, as we wrote in the chat, Medicare is not covered. Medicare Advantage plans typically cover, depending on the plan, 12 to 20 plans for low back pain. So if you have low back pain with the other plans, your provider can bill under low back pain as long as you have low back pain for any Medicare Advantage plan that does cover acupuncture. How do MDs know when to refer to acupuncture? You know, this is a good question too. We have a cited document on asacu.org, which is a one-page document for your MD if they're unclear about what acupuncture does. Many are clear about what it does, but if they're unclear, this is a place to send them. And my favorite study, which is stellar and was just updated, is the Tick and Nielsen paper, colloquially referred to, that talks about acupuncture itself as a multimodal treatment, right? We know from the work of Vitaly Napadao that in real time under fMRI, acupuncture changes brain blood flow. We know from the work of Lynn Langevin, who's an MD licensed acupuncturist researcher, they're both instructors at Harvard Medical School, that acupuncture affects the fascia of the whole body when you put a needle in. We know from long-standing work that acupuncture, when you put in an acupuncture needle, the same sites light up that light up when a patient is given opioids. Next slide, please. So these are the questions that everybody will have, because this will come if you want to ask your plan if they cover acupuncture. Do I have acupuncture coverage? For what diagnoses? Because for some plans, it's specific. If it's a Medicare Advantage plan, they will only cover for low back pain. Other plans cover headache, but not anxiety. Other plans cover headache, anxiety, low back pain, knee pain. So knowing what that is will be helpful so your provider can get paid and you can use the coverage you pay for. What is your copay? How many treatments do you have, which I'm sorry is not on here. And if your deductible comes into play, and if so, have you met it? Because some plans are exclusive of a medical deductible that you might need to meet for a medication, but you won't need to meet for acupuncture as part of the evidence-based non-opioid treatments for pain. Next slide, please. Okay, so our goal, all of our goals, all of the providers who are here, whether they're speaking or whether they're on this webinar, we are all here to support and serve you. We are here to provide value to you, right? And the self-care that we talked about earlier, and there were great ideas for self-care, right, will help you to manage your symptoms and be your best self in this moment as you are present with the challenges in front of you today. I have a lot of free information on my website under forms and downloads, and you are more than welcome to reach out to me directly if you're in Massachusetts and have any questions about insurance. Christy, I know Neil Miller asked a question about insurance in here. Don't know. Okay. Oh, where can you obtain copies of the slides? They'll be sent. That's not my jurisdiction. Back to you, Christy.
All right, wonderful. Thank you so much.